At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Early Onset Dementia and Alzheimer's on Wednesday, December 17th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome, everybody. This is Dr. Tom Roselle, and you're listening to, me, Ageless Health, and the things that we do for you on an ongoing basis every Sunday at high noon in the Washington metropolitan area, right here on WMAL 105.9. Have an interesting platform today. We've been talking about dementia, but I want you to understand that there are many ways of reversing it. First, let me start with this. Did you know that 80% of adults in their late 50s begin to have cognitive dysfunction? That's 80%. That's huge. It's a big number. So if we have that type of ongoing problem, and it continues to seem to be getting worse, the studies show that this exponential rise in mental deficiency, if you will, started about 2.5 decades ago, 3 decades ago. And it has to do with a lot of stuff. Now, what are we talking about? We're talking about, just as a recap for you, the exposures that we have epigenetically. That just means all the environmental stuff around us that's affecting your body's ability to do what it's supposed to do. So when you have that flux of incoming bad stuff, can we identify it, and do we know how to fix it? The short answer is yes. And by the way, I want to remind you, coming up on the 17th, in about a week and a half, I guess, here at the Roselle Center in Fairfax, Virginia, Dr. Scott Lamp and I are going to be doing a program on your mind, your brain, and how you're going from memory loss to potentially the scary thing, that big A word called Alzheimer's. But you don't have to go there, and you can reverse it. And we're going to show you how to do that. So make sure you give us a call, and do it today. Give us a call at 703-698-7117 or 703-698-7117. And let's educate you. Let's show you what you can do. Let's put your hands on. But we're at that time of the year, and guess what we're calling this program today? All I want for Christmas is my memory back. Yeah, not my 2 front teeth, but my memory back. And if that's the case, can I get it back? And the short answer is yes. You can either stop it from advancing almost 100% across the board, or you can begin to reverse it, or you can fully reverse it and get it back. So here's the deal. Let's talk about exposures, external stuff. What can you do to blunt this nonsense? Well, first of all, think about the environment that you live in. There's a huge relationship between electromagnetic fields, EMFs, and memory loss. Did you know that? What's an EMF? It's low volt electromagnetic influences. That's your cell phones, that's your car, those are your laptops, all the data centers that we're being surrounded for here in good old Virginia, hundreds of them in Loudoun County. That has an impact on memory and capacity in what we call neurogenesis. That means the re-stimulation of nerve cells, but that neurogenesis can be good stuff or it can be bad stuff. But the EMF exposures are significant, and they have to do with radio frequencies. Radio frequencies, exposures to electromagnetic fields, all those little things we're talking about, the wearables that you put on your wrist as well, same type of thing. They can influence, they can have an effect on your health across the board. But more importantly, what we're talking about is the impact it has on your brain health and the cognitive decline that we're seeing across the board on, so many different levels. It's not okay. So when we're looking at, the brain and we're wondering why things are starting to go south on us, there's a relationship that we have to explore, and these radio frequencies are one of them. So what else do we have to be aware of? What other things may have an impact? Well, we're talking about our day-to-day life, right? We're talking about the water that we drink, the things that they're putting into the system. Controlling your brain expression, we call that brain waves, frequencies. If we can modulate that, if we could make a difference in them, we could improve recall and potentially provide a key to unlocking and reversing conditions like Alzheimer's. Now, in our practice over many years, we found that there are things that will stop it. You've heard me talk about MCTs before, medium chain triglycerides. You get those from organic coconut oil, and the studies have shown that that's true. You can look at the, if you will, the communication chain of the brain. Those are done by looking at the neurotransmitters, these little back and forth chemical communicators in the brain, things like taurine and tyrosine and dopamine and GABA and so forth. And the list goes on. If they're not in balance, stress levels go through the ceiling. If they're not in balance, you can get neurological disruption, in some cases permanent. That, we talk about, well, in the worst case scenario, the Alzheimer's pattern with amyloid and tau beta proteins and so forth. Are they the result or are they the cause? Well, there's a lot of people will tell you those are the cause, but they can be the result of other things that we're doing. And that's what we want to make sure that we understand. And on the 17th, we're going to be doing that. So let's talk about what can you do now to reverse and change your electromagnetic pathways of your brain. Understanding brainwave entrapment, and that's entrainment, not entrapment. Entrainment is what really needs to be applied the right way. But before we get into the different types of things that you can do, we have to understand that the brain works on frequencies, and they're characterized by terms like beta and alpha and theta and delta and gamma. Now, beta waves, that's when you're alert and you're thinking. You're somewhere between beta and alpha with me right now. If you're really locked in and you're kind of in that drift off state and you're not aware of anything around you, you're in alpha state. Beta is you're alert and you've got active thinking, you're problem solving. That's what beta is. Now, theta waves, they represent your sleep pattern, the deep relaxation. And they go from light sleep into deep sleep and so forth. And they're associated with intuition and creativity. That's theta. And the delta waves, that's your deep, deep restorative sleep. That's where you want to go when you want to heal yourself. And when you talk about gamma waves, right, those are 30 hertz and above. They're connected to higher levels of cognitive processing and deep, deep concentration. Now, so we said beta waves. There's a hertz levels associated with it. If you want to stay in beta, your faster frequencies at 14 to 30 hertz. Alpha, you're 8 to 13. Theta, 4 to 7. You see how it gets lower and lower? And then the delta waves, where your brain is just really at a low level, you're at 0.5 hertz to 3 hertz. So what does that really mean? So brain wave, if you will, entrainment, meaning that it's working the way it's supposed to, involves using these frequencies, these rhythmic frequencies, and you can trigger them visually and you can trigger them auditorily, and they will help synchronize your brain to very desired frequencies. And we do that with things like low-level laser patterns. We do it with pulsar and scalar frequencies. Now, I think you all heard at one time and the other, there's something called binaural beats for memory enhancement. And it's a popular form of what we're talking about, brainwave entrainment, to keep things in a very specific pattern. So you're not floating up and down in those levels of beta and theta and alpha and gamma and so forth. So if you bounce up and down, you're not going to be able to focus. So for memory enhancement, the beats that promote alpha or theta brainwaves are the most effective. So we want to get into that two areas. So if we want our brains to work, if we want to be able to remember, we have to begin to listen to things that promote alpha or theta brainwaves. They seem to be the most effective. And as we're listening to alpha frequencies, we can begin to retain information better. Again, what an alpha frequency is, have you ever found yourself, you're listening to something, you're locked into music, or you're watching a television program, and somebody says something to you, but you don't remember anything that they said because you weren't present? It's like a hypnotic state. That's your alpha state. And then you go deeper, you go into theta, and you really get into a hardcore, learning process. So we want to be able to resynchronize, reorganize the brain. And a lot of our patients that show up with traumatic injury, ongoing pain patterns, they disrupt those frequencies. So if you had a headset and you play tones that have those frequencies embedded in, that you'll find that just with that tone at a low level, and you try to study something, you try to learn something, it will be really astonishingly impactful. So light and sound can have a tremendous impact. You can have these modulated in light, you can have modulated in sound. Just go onto YouTube and put some of these frequencies in. Look at, see alpha frequency, or beta frequency, or gamma frequency, theta frequency. But remember, we want to spend a little time between alpha and theta. And if you could do that like 20 minutes a day in a quiet environment where you can focus, you're going to find that your levels of cognitive recognition and entrapment, if you're learning, will be far greater than you could possibly begin to imagine. Now, how about if we have a problem? What else can we do? What can we do to kind of shift and change? Well, it's called detoxification. We've got to be able to clear what's called the glymphatic system of the brain. The glymphatic system, when it's backed up, that's your lymphatic AAA garbage disposal of your brain, is going to cause an inflammatory reaction, and it's going to cause the system to be degraded, broken down, destroyed ongoingly. What can a person do about that? There's a lot that you can do about it. You have to understand what the process is. You have to make sure, that we're programming it the right way. So first of all, we want to get rid of the toxins. How can we do that? Well, you can drink hydrogen water. Hydrogen water and memory are tremendous in their hand-to-hand application. Hydrogen water has been shown to have a positive impact on memory and cognitive function. Research indicates, there's a ton of it out there, indicates that hydrogen water can help preserve memory so you don't lose it, and particularly in brains that are aging, mine and some of you that are listening to me and so forth. And it reduces, and here's the piece, it reduces the oxidative stress. Oxidative stress leads to pathology like Alzheimer's, and enhances alertness compared to things like caffeine. So a glass of hydrogen water not only detoxifies your system, but it upregulates your body to be able to be aware. Studies across the board, and I was really surprised that they were so well hidden, if you will, have demonstrated huge improvements to the hippocampal area of the brain. And it reduces the amyloid plaquing and accumulation. So if you can get somebody to drink hydrogen water on an ongoing basis that has memory decline, you're going to find that they're going to be sharper, they're going to be in a better mood, their energy is going to come up, it's really impactful. It's very significant. And all the information out there proves it. It's not something that Dr. Tom Roselle is telling you just to get your attention. It's one that has been known now, and the research has been studied, again, outside of this country, often more so than here. So what are you going to do about it? How are you going to fix it? What differences that can you make in setting this up? Well, the truth of it is there's a lot that you can do to make a huge, huge difference. So we talked about what? Sleep patterns. Go to bed, cool room, make sure there's no electromagnetic currents around you, all your iPads, all your wearables, get them off your body, and same time every night. Second thing, get rid of the junk in your body. You've heard me talk about some of the fast foods. Did you know that the studies that they did with McDonald's hamburger and French fries, that they just kept it in the bag and never did anything with it for 2 years, and there was no degradation, there's no deterioration of the substance? It's because they were preserved. And when they put that into your body, you eat it, right? You are being preserved, and it does the same thing to your body's tissue. So I would encourage you that Mickey D's may not be your best bet, or any of the other fast food areas. I don't touch that stuff. I don't know about you. I just don't. They would go bankrupt if they had people like me. But I know what it does, and I'm not allowing it to come into my body. So it's your call, my friends. It's your ability. Do you want to have a life, or do you want to just be preserved like a mummy? I don't know. I think there's a pretty obvious answer there. Now, let's talk about scalar frequencies. And there's ways of quantifying, if you will, what happens with the brain. And you can run different brain patterns. We have a test in the office that we use, and it's a finger prick blood test. And we're going to introduce that to you on the 17th when you come to the class. And it is coupled with an online processing on the computer. So you do the blood test. It gives us all the deficiencies, whether taurine levels low and your triple EF agar, meaning your omega fatty acids are low, your B complex is not working the way it's supposed to, as it relates to brain health and brain function. And so we do that and measurement with some other things. Then we put you on a computer and we let you do different types of focusing and cognitive memory patterns on it. It's real quick. And we get a report back from the company, and it tells us exactly where you're broken down. And then we match that up with some other testing that we do. But here's the interesting thing. The majority of that cognitive decline, that majority of, where did I put my keys, can be resolved. Now, if you're stuck where your brain is destroyed, different story. But we've talked about even somebody who's in Alzheimer's. I've talked to you about the studies where using MCTs, medium chain triglycerides, which are extracted from what the best form is organic coconut oil from the jar, getting about 8, 9, 10 teaspoons or tablespoons a day, has been shown repetitively to stop the progression and in many cases make a significant reversal in its progress. And the first thing that we have to remember is that nothing works for everybody. But if we start putting multiple pieces of the puzzle together, we get away from the insult of the talking heads. We stay off of our phones. We limit the exposure of the incoming electromagnetic frequencies that are surrounding us ongoingly. But, if you're always tired and you just don't have the get up and go to go up and do, if you will, that chronic fatigue pattern is often pointing to an energetic imbalance in your body, not just lack of sleep. That midday crash that you get up, or you have no oomph when you get up in the morning, and you rely on that caffeine just to function, not just a little caffeine. You're drinking a damn pot of coffee every day. That is a significant finger pointing that you've got a problem. You want to get it squared away? You want to get it fixed? Well, I would encourage you that there's a way around this thing and not to just go down the tubes and take the medications. If your doctor says, well, let's try Aricept. Aricept is the number one Alzheimer's drug, right? Doesn't work. If you look up the studies, go to PubMed and look up effectiveness of Aricept and see what it says, I think you're going to be surprised. So you say, well, what's somebody supposed to do? There's a lot of things. You have to chelate the junk out of the body. You have to reset, restore, refigure things that have not worked for some time. It's important that you understand that standard of care is not necessarily the standard that you need to follow. But we're talking about a lot of different things. Detoxification of the system, using hydrogen water. We're talking about getting rid of the junk food, the sugar, sodas, coffee, fast foods, fried foods, alcohol, gluten, additives, preservatives, all the nonsense, the GMO products. We're looking at modifying the radio frequencies, the electromagnetic fields, low volt electrical fields that are around us that are associated with not only cognitive decline, but all kinds of other health problems as well. It's very well established. This is not just Dr. Tom telling you these things. It's there. If you go into different websites and going, and where a lot of this comes out of, by the way, is the UK and Europe, and because they are far better in their sources than we are. There was an Occupational Safety and Health Administration study about radio frequencies and microwave radiation and about what it does to your health. And if you check those out, there's another one that was funded by the International Commission on non-normalized frequencies. You'll see that said, oh my God, why does anybody hide this stuff? Why do they not tell us about it? What is it that we're not supposed to know about? You are being polluted on an ongoing basis. Some of it is do it yourself. Some of it is being done to you but everything from, radio waves that are not normal, frequencies that are aberrant, wavelengths that are caustic. All of these things we're going to discuss on the 17th. And I have the pleasure of co-teaching that program with Dr. Scott Lamp. It's going to be a fun night. We're going to have a great time together. We're going to put things into perspective that, more importantly, that you can do something about. So join us. All you got to do is go to, rosellecare.com. That's ROSELLECARE.com, rosellecare.com, or simply call the office at 703-698-7117. It's at 6 p.m. on December 17th. It'll be the last in-house program for this year. And we'll start again in January. And we've got a real special program coming up for you in January, but we're not going to tell you about that right now because we want to give you all the information. And I want to give you your brain back. So that's why the name of this program is All I Want for Christmas is My Memory Back. And you can get it done. You can make it happen. You can, take steps. What happens if you could stop the progression of the decline and get 10% of your memory back? Would that be worth making some choices differently than you're making them now? I don't know about you, but the answer for me is yes. So we're all of that progression. We're getting above that 50 mark, 60 mark. And if the statistics are right that 80% of us have some memory decline at that level, not okay. But isn't it better to understand that you can change it? You can do something about it and stay away from the effects of brain tumors and all kinds of neurodegenerative diseases? I'm working on it. I got a lot of things to do yet. I want to make sure that you have that opportunity. You get to say yes or no on your own without somebody influencing you to do something different. Wouldn't it be good to make sure you don't get the glioma or the brain cancer? The short answer is yes. And much of our habits are doing that. We're coming up to the end of the program. I hope that I've given you a little bit of something to think about, and that you'll join us on the 17th. Please be there because I promise you a gift that you're not going to get anyplace else. This is Dr. Tom Roselle. I'm here every Sunday for one reason only. I love you all. Have a good day.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular
neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Early Onset Dementia and Alzheimer's on Wednesday, December 17th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.